Hi everyone. Let's go through some of the Saudi Council prometric exam for nurses. Cleft palate and cleft lip. The age for surgery repair is for cleft lip 3 to 6 months after surgery. Consideration of elbow restraints. The infant should not be allowed to cry and to breastfeed by sucking. Never to put the baby in prone position after cleft lip repair. Cleft palate is the age 12 to 18 months and position after surgery is prone position. The consideration after the cleft lip and cleft palate is burping the child frequently every 15 minutes. To prevent cleft lip and cleft palate, the pregnant woman should be advised to take folic acid 400 international unit, increase green vegetables and citrus intake, and feeding upright sitting position. A 2-month-old infant with cleft lips is seen in the primary health care to get the regular vaccine for 2 months. The mother asked proper time for the corrective cleft lip surgery of the infant. Which of the following is the best nurse response? No specific age. It is too late. The age of 2-month-old is the time for repair and the proper time for repair after age of 1 year. So the correct answer is 2 months. The nurse have been teaching a new mother how to feed for a newborn with a cleft lip and palate before surgical repair. Of which of the following action from the mother indicate teaching has been successful? Burping the baby frequently, prevent the infant from crying, placing the baby flat during feeding, and keep the infant prone following feeding. So the correct answer is burping the baby frequently. Mother came to the outpatient department with an infant having cleft lip and palate. The infant was underweight, so the nurse has to consider teaching the proper way of feeding the child in the treatment plan. Which of the following is the proper way of feeding? Use a non-squeezable bottle. Feed infant in an upright sitting position. Enlarge nipple holes of bottle to allow more milk to come. Feed infant longer than 45 minutes to allow more food to intake. So the correct answer is feed infant in an upright sitting position. A 40-year-old woman, gravida 2 para 2 and is currently conceived. Her previous pregnancy resulted in birth of cleft lip and palate. The patient is anxious and concerned pregnancies about she had a genetic counseling and which food she should take to prevent the recurrence. Answer is green vegetables and citrus fruit. A nurse is caring for a newborn with cleft lip. At what age would the nurse expect the doctor to repair? Answer 3 to 6 months. A 2-day-old newborn is admitted to the newborn nursery while the nurse is administering oral feeding. The milk returns through the child's nose and mouth and the infant is becoming cyanotic. Which of the following condition the newborn should have? Answer is tracheoesophageal fistula. Which of the following vitamin supplements can decrease the incidence of neural tube defects such as anencephaly and spina bifida in newborns? Answer, folic acid. 5-month-old boy has been vomiting green-colored vomiters and has intermittent abdominal pain during which he draws his chest, turns pale and cries forcefully. On observation, the stool has jelly-like consistency. Abdominal palpitation reveals long tube-like mass. No fever, rash or diarrhea. Hyperactive bowel sounds on all quadrants. Which is the most likely form of initial treatment? So in such case, the initial treatment should be normal saline enema. 7-month-old infant is seen in the emergency department suffering from episodes of severe abdominal pain. The infant's stool is like red jelly. Abdominal examination reveals palpable sausage-shaped mass in the right upper quadrant. Which of the following is the first line of therapeutic management for this infant? Answer, non-surgical hydrostatic reduction. 7-month-old infant is seen in the emergency department suffering from episodes of severe abdominal pain. The infant's stool is like red jelly. Abdominal examination reveals palpable sausage-shaped mass in the right upper quadrant. Which of the following is the best diagnosis? Correct answer is intussusception. A nurse is preparing to care for a child with diagnosis of intussusception. The nurse reviews the child's record and expects to see which sign of this disorder documented. Watery diarrhea, rib bone-like stool, profuse projectile vomiting, red jelly stool. So answer is red jelly stool, that is connected with the intussusception. 5-year-old child was seen in the emergency department with abdominal pain. Palpable sausage-shaped mass and intussusception is suspected. Which of the following is the best diagnosis to evaluate this? Answer, ultrasound. Patient returned to the surgical unit from a thyroidectomy. The nurse observed that the patient is awake, blood pressure is 90/60, heart rate is 108 per minute. What immediate action should the nurse take? So the patient had a thyroidectomy. So check for the back of the neck surgical dressing for any bleeding, because the blood pressure is low, 90/60 only. The heart rate is high. Complication of thyroidectomy is distension, bleeding, vocal cord injury. So what is the main complication? It is bleeding. Progressive enlargement of a multinodular tracheal compression, including pain at the site of the ear and jaw, difficult swallowing, change of breathing pattern by compressing esophagus. What is the preferred treatment? Answer is surgical resection of abnormal thyroid. Patient is being admitted to the recovery room following thyroidectomy. The back of the neck wound is covered with dressing. During the first 15 minutes of post-surgery, the patient started waking up and having diarrhea. A general assessment is performed with special attention given to high risk for hemorrhage. Where would bleeding most likely occur? Because the patient is lying, it will go to the back of the neck. So check the dressing on the back of the neck. 3-year-old child with elevated body temperature and administered oral aspirin. The nurse documented that the body temperature of the child too hourly. The American Academy of Pediatrics suggests that removal of the tonsils under certain conditions. Which of the following meets these conditions? So the tonsillitis accompanied by adenoid inflammation is the standard for removing tonsils, right? So tonsillectomy, American Standard of Pediatrics suggests tonsillectomy should be done only if tonsillitis with adenoid inflammation. 5-year-old child is postoperative after tonsillectomy. The nurse should ask the patients to give the child which of food after discharge from the hospital. So postoperative after tonsillectomy is soft food, mashed potatoes and soup. The nurse is caring for a child postoperative tonsillectomy. Which of the following nursing assessment is suitable for the post-op care? Observe for subtle signs of hemorrhage. So majority of the time, the surgery you have to observe for hemorrhage. The nurse is caring a child postoperative tonsillectomy. Which of the following nursing action is suitable for the postoperative care? Place the child in the prone position, right? After tonsillectomy, a child begins to vomit bright red blood. The initial nursing action is to notify the physician, turn the child to the side. So correct answer is turn the child to the side to prevent the aspiration. 29-year-old man in the surgical ward on his first post-op thyroidectomy. He appears drowsy, but he is able to respond by nodding head. He is developing mild restlessness. What is the initial recommended goal of care? Monitor vital signs of thyroid storm, because it's thyroidectomy, right? 18-year-old college student was rushed to ER due to fainting at school. He complained of severe abdominal pain on right upper quadrant. Upon palpation, he jerks even with pressure. What is the most likely diagnosis of this patient? Severe abdominal pain on the right upper quadrant is appendicitis. Yeah, that is the typical sign. 7-year-old child was admitted with suspected appendicitis. The nurse was evaluating the child's condition, and the mother stated that the child is constipated for 2 days and requested for laxatives. What is the risk of giving laxatives to patient with appendicitis? That is rupture. So you cannot give laxatives to this child. The patient to be discharged post appendectomy. The precautionary measures plans are discussed with him. What is the most important desired outcome of post-discharge? That is, remain free of post-surgical complication. Among all these things, right? Report fever, redness, use pain management, and resume gradual activities to avoid weight. So, among all these things, the post-op goal of care is remain free of post-op surgical complications. 17-year-old patient arrived to the emergency room complaining abdominal pain on right lower quadrant. Pain was 9 numeric scale with positive rebound tenderness over the pain. Blood pressure is, so blood pressure, heart rate and temperature like this. Blood pressure 120/70, 95 per minute heart rate, and respiration is 20 per minute, and temperature is 39.2. So which of the following intervention is the highest priority? Keep the patient NPO because there may be possibility of any surgical intervention. The nurse would increase the comfort of the patient with appendicitis by flexing the patient's right knee. Treatment of nephrotic syndrome is corticosteroid. Nurse is preparing for a scheduled medication due at 6 p.m. If a doctor ordered paracetamol 1 gram QID and it was supplied from the pharmacy as 250 milligram, which of the following is the most appropriate nursing action? So if the doctor ordered 1 gram and the pharmacy supplied 250, she should give 250 milligram tablet, right? So give the patient 250 milligram tablet. That is the correct answer. Not to call the pharmacy or call the doctor to recheck the dose. She should administer 4 tablets. 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. Nurse is preparing to give IV hypertonic solution. So blood pressure is 110/70, heart rate is 76, respiratory rate is 18, and temperature is normal. Which IV solution is appropriate? So the hypertonic solution. This is normotonic. This is also normal. This is hypertonic. This is hypertonic. 0.45% sodium chloride is hypertonic solution. The nurse administered a dose of morphine sulfate as prescribed to patient who is in post-anesthesia care unit. The patient appears to be resting comfortably. The respiratory rate is 8 and oxygen saturation is 86% with 2 liters of oxygen via nasal cannula. The nurse should immediately administer. So this patient's respiratory rate is 8 and started desaturating. So what is the patient already received morphine? So we should administer the medication to revert, right? That is naloxone, Narcan. Digoxin not given to a patient who has bradycardia because digoxin will increase the bradycardia. The heart rate will still go more down. So you shouldn't be administering digoxin for a patient who has bradycardia. Atropine is indicated to increase heart rate. Morphine can cause bradypnea. Bradypnea is respiratory rate low. Low respiratory rate is called bradypnea. A soldier was brought to triage area after being exposed to chemical weapons. Signs and symptoms of gas exposure were noticed. The nurse prepared for medical management. Which medication should the nurse prepare for the patient? Answer is atropine. Yeah. A nurse is caring for a patient who had coronary artery bypass graft, CABG, 4 hours ago. The nurse notices the patient is disoriented and restless. The patient reports nausea, weakness, and paresthesia in the extremities. Sodium is 145, potassium is 6.8. This is very high, right? 3.5 to 4.5 is the normal. Calcium is 2.5. It's somewhat normal. So which of the following is the best medication? So here the potassium is the abnormal. So to reduce the potassium, sodium polystyrene sulfonate, that is KXLate, yeah, to reverse the effect of potassium. Which of the following statement by the nurse about the Clomid as an ovulation inducing drug? It increases the risk of multiple pregnancies. Clomid is prescribed for a 32-year-old for infertility treatment. The nurse should understand that this medication is used for following action. What is the reason for administering Clomid? Induce ovulation. Correct? Nurse is caring for a client with bipolar disorder who is receiving lithium carbonate. Before administering the next dose, the clients complain of nausea and vomiting, and the nurse finds the client's lithium blood level is 1.5 milliequivalent per liter. Which of the following action is considered as priority? That is, hold the next dose. Patient was on regular dose of lithium carbonate. The nurse noticed that he has hand tremor, polyuria, diarrhea, and vomiting. What immediate action should be taken by the nurse? Hold the lithium, because this is the lithium toxicity signs and symptoms, right? Nausea, vomiting, all these are the signs of lithium toxicity. Patient was on a course of lithium carbonate drug. During the assessment, patient complained nystagmus, visual hallucination, and oliguria. So, which of the following drug-related complication explain these symptoms? The severe toxicity, because patient already had nystagmus and visual hallucination and already kidney is affected, oliguria. So this is severe toxicity of lithium carbonate. 49-year-old woman presented to the emergency department, complained of severe chest pain. ECG showed that the patient has myocardial infarction. The doctor ordered the nurse to give aspirin. What is the primary indication of aspirin in this case? Decrease the formation of platelet plaque. That is the reason why the patient was given aspirin. Which of the following condition is a contraindication for a woman to use oral contraceptive? Dysmenorrhea, menorrhagia, thrombophlebitis, and toxic shock syndrome. So, thrombophlebitis is contraindicated for administering oral contraceptives. 45-year-old distressed and restless patient in the psychiatric ward was unable to sleep during the night for last 2 days. He was ordered sleep medication which was to be administered at 10 p.m. At that time, the patient was found asleep in bed. Which of the following action should the nurse take? She should hold the medication and record and report, right? She shouldn't wake the patient up because the medication is for sleeping and patient already sleeping without the medication. So leave him and document it. Nurse is given health education to the patient, how to reduce febrile avulsion in the child at home. Which of the following medication is the safest intervention for febrile avulsion? So for fever, which one you will give? Antipyretics, right? Antipyretics. And analgesia is for pain, antibiotic is for infection, and antiemetic is for vomiting. A home healthcare patient with COPD complained of stomach upset. The patient is taking triamcinolone. Which of the following counseling should be given? So triamcinolone should be taken with milk or crackers. Theodore with milk or crackers. So this should be administered with milk or crackers. That is the answer. Which of the following vitamin is necessary for wound healing process? Answer is vitamin C. Vitamin C. Which of the following vitamin supplements can decrease the incidence of neural tube defects such as anencephaly and spina bifida? We already discussed this question. The answer is folic acid. So during pregnancy, the pregnant woman should take folic acid to prevent all these things. 78-year-old woman who lives in long-term care facilities having repeated episodes of urinary tract infection. She is prescribed with the amine mandolate 1 gram to be taken by mouth 4 times a day before meals and at bedtime. The nurse advised the patient that she needs to remove milk from the diet while taking the medication. What is the primary purpose of this dietary advice? The reason to make urine acidic. The nurse received a serum digoxin level results for the patient and notes that the result is 2.6. The result of normal value for men is 2.6 to 8.2. So which of the nursing action is the most important? Because the patient already have normal digoxin level, right? And so what she should do? She should notify the physician to hold the medication. She cannot hold by herself. So she need to notify the physician. Thank you and see you in the next session. I hope you understood.